Hi, I'm Lisa Squire, Senior Communications Advisor with Alberta Health Services, and this is Health Matters. Today we're going to be talking with Lisa Serrato, a clinical exercise specialist with the Alberta Healthy Living Program here in the South Zone. And we're going to be talking about the heart and exercise and how important it is to keep our hearts fit, which is a perfect conversation given that February is Heart Health Month. So welcome, Lisa. Thanks for being here.
Thanks for having me.
How does exercise and fitness affect the heart?
So primarily aerobic exercise is what affects the heart. It's the heart and the lungs working together to move that oxygen down to the muscles that need it. So when we think about being aerobically fit, we're thinking about using large muscle groups. So activities such as walking, cycling, swimming, dancing, those kinds of things are wonderful activities for strengthening the heart.
So if a person wants to both kind of lose weight and make sure that they're doing exercises that keep the heart healthy, are there specific exercises they should do?
Absolutely. When we look at components of fitness for helping people to lose weight and be more physically fit, we do want to incorporate those aerobic activities. So we're looking at 3 to 5 days of moderate intensity exercise where you're doing anywhere from 30 to 45 minutes. And then adding some strength training into your routine as well. Adding light strengthening activities with lots of repetitions will help people to build up that lean body muscle tissue, and that will in turn help them to lose weight faster.
And what about if a person wants to lower their blood pressure? Are there different exercises that they can do for that?
Well, just being overall active will help to naturally lower the blood pressure. Different types of activities do have an impact on your blood pressure, though. So things to keep in mind is that you want to make sure that your blood pressure is stable before you look at doing any specific activities, particularly heavy lifting or anything over your head. That's going to add extra pressure to that heart and to that blood pressure. But adding a well-rounded routine in, looking at aerobic exercise, strength training activities, and some stretching will certainly help people to lower their blood pressure naturally.
And do you have any advice or tips for people who want to increase their physical activity and who also want to make sure that they're actually sticking with it?
Absolutely. Take some time and sit down and make yourself a list of what motivates you to exercise. Is it that you want to, be there for your family? Is it that you want to be able to live a longer life? And then you want to look at, is this something that you want to do independently, or do you prefer a group setting? There's lots of group classes out there available. Find an exercise buddy if being in that kind of a scenario will help you to stick with it better. Keeping an exercise diary can be quite motivating as well to help you to see if you're making some progress. And it's important for us to think about making progress as we're physically active in order for us to continue to make those changes.
And if somebody has a pre-existing condition, are they still able to exercise, or are there things that they need to do differently?
Absolutely. We encourage people to be physically active if they've got a pre-existing heart condition. Things to keep in mind, obviously, they want to speak with their doctor before they get started to make sure they have been cleared for exercise. But making sure that you have on a warm-up and a cool-down so that your heart and your lungs have that opportunity just to kind of dilate a little bit more naturally. Making sure that you're staying within your own pace, taking breaks as you need to. And hydration is really important as well, not just for replenishing fluids, but to stabilize your blood pressure as well. So.
Okay, thank you so much, Lisa. I think that those are some really great tips. It sounds like there's a lot of different options out there for people to stay healthy and to keep their hearts strong. So I'm Lisa Squires, and this is Health Matters. Thanks for watching.